Hello student, in this video lecture we are going to discuss about the parts of respiratory system, organs of which are involving in the respiratory system. First we are going to discuss about the nasal cavity and nose. As you know that nose is the most protruding part of the face. When you are seeing your face from the anterior side, your nose is the most prominent portion on your face. Your nose from the anterior side, when you're seeing that there are two openings of the nose, these are called the nostrils, and these nostrils are separated by the nasal septum. Your nose is made up by the nasal bone and the cartilage. The main function of nose is breathing, and the nasal mucosa lining the nasal cavity, that is paranasal sinus, carries out the necessary conduction of the inhaled air by the warming and moist it. But your nose is also have the principal organ in the olfactory system. It provides the sense of smell to you. The nose posteriorly, it is connected with the shell like structure that is called nasal conchlea. These nasal conchlea have the three nasal conchlea is there: inferior, superior and medial nasal, superior nasal conchlea, inferior nasal conchlea and medial nasal conchlea. These are the cavity play a major part in the process of respiration. To filtering of the air by the nasal hair in the nostrils prevent large particles from the entering into the lungs. Sneezing is a reflex. Sneezing is a reflex to expel unwanted particles from the nose that irritates the mucosal lining. Sneezing can transmit the infection. That infection is called droplet infection. Uh, that can carry the harmful pathogens. So when you are sneezing, put some uh, uh, cloth, or put a napkin on your nose to prevent the infection. So here we are discussing that the nose having the two main function, that that participates in the respiration, and it also have the sense of smell, means in the olfaction. The area of olfactory epithelium, that is in the top of the nose, in the upper nasal that are found in the upper nasal cavity. You can see in this diagram, that is the olfactory region, that having the olfactory bulb, it having the it is the part of nervous system which carries the sense of smell, that's located on the upper side of the nasal cavity, that contains specialized olfactory cells responsible for this function. The nose is also involved in the function of speech. The nasal it helps in the production of speech, that having the cavities of the paranasal sinus act as a sound chamber that modified speech and other vocal sound. Here we next studied about the blood supply of the nose. Your nose getting the blood supply from the maxillary, ophthalmic and facial arteries. Rather than that, it gains the oxygenated blood from carotid artery, also the branches of carotid artery. These ophthalmic, maxillary and facial carotid arteries branches makes a anastomos, that we can say that all are joined and forms a separate that forms and facilitate the separate blood supply, that facilitate the plexus that supply the blood to the nose. Okay, the veins of the nose include the angular vein that drains the side of the nose, receiving lateral nasal vein from your nose, and the angular vein joins to the superior labial vein. some small veins from that dorsum of the nose drains the nasal arch of the frontal vein. These are the blood supply of nose. The blood supply of nose, mostly here we are discussing that most your nose is getting the blood from the your nose is getting the blood from the ophthalmic artery, from the facial artery, from the maxillary artery, and a branch of carotid artery. From there, your vein is uh, collecting the getting the oxygenated blood, and the deoxygenated blood is collected by the vein. That is prominently there are two veins. We can say the superior labile vein and the angular vein that collects the deoxygenated blood from the nose. Next, we are discussing about the nerve supply. Your nose and paranasal sinus are getting the nerve supply from the two branches of the trigeminal nerve and the ophthalmic nerve, and also it getting the nerve supply by the branch of maxillary nerve. These three nerves can promote the nerve supply of the nose and nasal cavity and paranasal sinuses. This all about the nose. I hope that you may understand what is the nose, how does your nose is made up, and what are the function of nose, how it get the blood, how it drains its blood, and how it is supplied by the nose. Thank you, class. Thank you.